RCA lesion, sir, we have used a 3.5 15 for pre-dilatation. We started it with a 3.5 15, and then later on also we again used a 3.5. So I mean, the usual tendency that we have is that we use either a shorter balloon, and then when we are placing a stent, it's slightly longer. But we've used 3 identical sizes. So for the same concern as you have for LAD, if we are having some kind of micro dissection, we might not be actually able. So a 3.5 18, I mean, what is your view on that?
So it's not necessarily, as long as your 3.5 balloon matches your 3.5 stent and you're okay at the edges, you're absolutely fine. The thing is not to use a longer balloon than the 15 millimeters. And if you saw at for 4 millimeters, I used a 12 millimeter balloon because I felt that the distal couldn't go up beyond the 26. I've done 3.5 to 26. I was more concerned about the proximal end. So you're okay at the same size or a shorter, but you shouldn't be longer.